He said to me, "Mommy, I feel so empty inside, and I don't want to feel like this anymore."
We were always so almost like walking in eggshells and trying to be as proactive as possible, not to trigger anything.
Oftentimes, I'd feel overwhelmed and kind of just emotions kind of took control of my brain, It's like I couldn't really think clearly. I wasn't thinking about the situation. I only thought about the feelings that I had because I felt like I was hurting people around me, like I was hurting myself, and I felt like I couldn't do anything about it. I had no control.
So I was in 5th grade, and my brother's kind of always been like my partner in crime. He's been my best friend forever. And I was just very almost taken aback because it was like he was a different person when he was angry. And I just didn't understand why.
It didn't feel normal anymore. I made a phone call to the pediatrician's office and I described what had been happening in the house. And he said to me, "I'm going to say some things to you that are going to feel hard." And then he said to me, "When we get off this call, I need you to call Bradley Hospital and get in contact with their partial program." I remember feeling like the world stopped spinning, right? He said a lot of things that it was my baby, right? That I wasn't ready for. But I don't know, you just, as a parent, it's like a switch goes off in your head and you're on automatic pilot. Like everything we could do to help him, we were starting to find answers. I remember driving onto campus the first day, not knowing what to expect, but knowing that help was on the way.
We want to keep kids and families where they're supposed to be. We want to keep them in schools. We want to keep them in their after-school activities. We want to keep them together as much as we can. We have so many services that include medication management, individual therapy, family therapy, group therapy, which is pretty unique in the area. We really do it all here at Bradley Hospital. It doesn't happen without philanthropic support.
Everybody in the Ramirez family did the work. Christian would come to therapy, especially in the beginning. It was really challenging. We were doing a lot of things to challenge his anxiety, which isn't fun. And the parents are part of that too, because they have to be there to challenge him as well and manage all those behaviors at home.
He would build up so much anxiety or whatever throughout the day that instead of exploding and damaging things in the house or to himself, he would relieve his stress differently. And that was great.
Dr. Morrison really taught me how to ground myself, how to kind of stay in the moment, and how to realize what is happening, how to taking a step back and not letting all these emotions take control.
I think the biggest skills is seeing him challenge his anxiety to the point where people probably don't even know that he had social anxiety or that he still has some social anxiety because he is been challenging himself constantly. At school, he's making lots of new friends, joining new clubs, joining new groups, and things that I don't think he would have been able to do a few years ago.
How things changed in the house, we could breathe, we could exhale. Bella also started to feel away, started going through her own, mental health issues, and I called.
I was able to talk through things with Dr. Parker and really connect all of those few missing pieces, I guess, of my puzzle.
When Bella came to me, it was during a really stressful time. But again, she is someone who is super hardworking, really open to feedback, really open to change. Part of the reason why she is doing so well is the openness of her family, that flexibility, that willingness to learn and change and hear. That's how families progress in outpatient.
She really just helped me reframe this idea that I had in my head about what productivity means. I've been sleeping just basically enough to function like a regular person now, and that's definitely thanks to Dr. Parker.
After I started getting help, after I started becoming better and slowly growing as a person, even little things like being able to go to a restaurant and being able to order my food by myself, just things that seem so little. As I keep growing and continue to grow, I was like, this is who I wanted to be. And Bradley kind of helped me grow into the person who I always wanted to be.
The reason many of us go into child psychiatry is because we have the privilege of seeing kids get better and families get better.
Getting in contact with Bradley, and I say this often, it saved us.
Even now, I'm feeling a lot better, Bradley has helped me so much, done so much stuff for me and my family.
When I think about the progress that we've made as a family and that we've made as our own, individual people, my brother and I, I'm a little bit just in awe because I know that wasn't easy for anyone, and we each had to find our own ways to handle it, and we made it through the other end. And so I'm just like, I'm really proud of us.